Hi, I'm board member Kaya Frazier, and I'm here with our medical director, Dr. Joel Wells. Um, could you introduce yourself and tell us a little background information about you?
Hi, thanks, Kaya. Thank you for wanting to interview and invite me today. I am Joel Wells, and I've had the true pleasure of getting to be medical director and help out with such a great cause for Miles4Hips over the last few years. So I'm an orthopedic surgeon with a special interest and love for hip dysplasia and comprehensive hip surgery. I am currently medical director at Baylor Scott and White in McKinney of Comprehensive Hip Center, as well as the Hip Preservation Center at Baylor Scott and White.
Awesome. So you were saying you had a special interest in hip dysplasia and hip surgery. Anything specific that triggered that, or just you found that along your journey?
Yeah, just like you're going through, Kaya, right now, it really is all about a journey. And mine began when I was very young, wanting to be a surgeon or a baseball player. You can see the bats and the balls behind you. I always loved getting to work with my hands to fix things, and I was really interested in surgery, and I plus loved baseball. I had the pleasure of going to Tulane for medical school, and that kind of sparked my interest and love for orthopedics. From there, I went to Harvard for residency, and I had the pleasure of working with some phenomenal surgeons who sparked my interest in the hip. From Dr. Millis and Young Jo Kim to Dennis Burke and so many more that sparked my interest. And I really enjoyed the hip patient as much as the pathology, and being able to kind of treat from the young adult to the older adult and everything in between. And plus the anatomy is so complex and so fascinating. I truly loved it.
For somebody who's new to this diagnosis or just hearing the words hip dysplasia, what is hip dysplasia?
You know what? That's a great question, and I think often gets thrown around so easily. What is hip dysplasia? And it's used sometimes loosely, but I would define it as a spectrum of hip disorders in a way. And it kind of stems from the pediatric knowing of developmental dysplasia of the hip, which is screened when kids are very young, when a hip is unstable or possibly dislocated. When we see patients in kind of the younger adult, teenager years, or even kind of mid-adult life, it can stem from a spectrum of kind of slightly shallow hips to very shallow hips. And it's a spectrum of somewhat coverage of the hip and rotation of the acetabulum itself. But it also encompasses femoral deformities and other things that we're learning more and more about.
And going off of that question, what is hip preservation surgery?
Well, I think the overall goal of hip preservation and what it is that the dream to try to correct a deformity before end-stage arthritis happens. And so the belief that hips don't just wear out is something that I fight for and agree with every day, that there's usually a mechanical reason why hips wear out. And if you can correct those mechanics or improve those mechanics somehow in some way, whether it's surgery or even non-operative, then you may be able to correct the disease, which is, or prevent a disease, which is hip arthritis.
And what is hip arthroscopy?
Hip arthroscopy is a really cool surgery to be able to access the hip joint less invasively. And so using a scope or an arthroscope, we access the joint, the hip joint, via little smaller portals. And so people have heard of a shoulder scope or a knee scope or other scopes. It's a way to access the joint using an arthroscope. With a hip arthroscopy, you can repair and reconstruct and shave down and do a lot of things in it, but there is some limitation due to the complex anatomy and the difficulty it is for access of the hip.
And what is a periacetabular osteotomy, PAO surgery?
So a PAO, which you mentioned is a periacetabular osteotomy, is a juxtaacetabular osteotomy. So it's one of a few and some osteotomies around the hip joint, where you make a sequence of osteotomies, which is a cool orthopedic word that means to cut bone in a way. And so you create controlled fractures in and around the acetabulum in order to reposition the acetabulum in a better way to help provide a better mechanical advantage.
And does every PAO patient need a scope, or does it vary?
You know, you can't answer that yes or no, but I think every patient is unique and every hip is unique, and some hips have intra-articular pathology that needs to be addressed, and a way to do that is through an arthroscope. Some hips are diagnosed early where they have minimal intra-articular issues, and so less work needs to be done intra-articularly, and just more work needs to be done to correct the dysplasia. And so it depends on the hip and the amount of issues that are intra-articular.
Okay. And what should a patient who needs hip surgery look for in a surgeon?
Well, you know, the thing is, hip surgery is awesome, is complex and unique at the same time. And I think also the patients are all of the above as well. And so I think the patient needs to find a surgeon that they feel comfortable with and that they understand what they're getting into and the plan. At the same time, feeling comfortable and having the ability to correct things is sometimes unique in our specialty.
Is it important to find a hip preservation surgeon, or can anyone perform these procedures?
Well, usually not anyone performs certain osteotomies of the hip. And so I definitely think finding a specialist that is comfortable performing the necessary surgery is of utmost importance. And so, yes, I think having specialized training or specialized understanding of the treatments is very important.
Why do some surgeons do hip arthroscopies and some don't?
So hip arthroscopies are sometimes done with many different specialties. A lot of specialties may train in hip arthroscopy, but may not do the open procedures. And then some specialties may train in the open procedures, but not the arthroscopic. And so it's all depending on surgeon comfort level, but also surgeon training.
And what should a hip surgery patient look for in a physical therapist?
Oh man, yes. So first of all, I think that's the most important is to look for a physical therapist. And so for each hip, having a team of not just the surgeon, but the physical therapist, a non-operative provider, sports medicine, a non-operative provider is so important. And so looking at a therapist that is willing to stick with you and work with you and understand the mechanics of the hip is important, because treating hip dysplasia and understanding hip dysplasia or even any pathology of the hip, it's very different than some of the other things that some physical therapists may treat, where it's somewhat limited in the time that it may last. Whereas this is a mechanical or structural issue. And so this is more about education and lifetime management of the hip.
Is it important to do prehab before surgery or physical therapy, or is it only important to do PT after surgery?
I think PT is lifelong, and it's a spectrum from before surgery and after surgery. At the same time, sometimes it is believed that when a patient goes to physical therapy, they may think they may be cured of something, and having realistic expectations that physical therapy is a part of the process of helping, but it is not necessarily going to correct everything. And so I think prehab is important in gaining that understanding.
Okay, so what is the training path like to become an orthopedic surgeon?
Well, today's not only St. Patty's Day, but it's also match day. And so some of the awesome med students that I got to work with match today, and all different specialties, but some in orthopedics. And so orthopedic surgery, you first go to medical school, and then you would match into orthopedic surgery residency, which for the majority of programs is a 5-year program. And then from there, you can choose to do a fellowship or other advanced training specialties.
Would you say that you have good work-life balance?
Oh yeah, I got the best job in the world, and the best life in the world, and family. And so without a doubt, I love being an orthopedic surgeon. It's extremely rewarding, and depending on what specialty you go into within orthopedic surgery, you can carve out kind of the life that you want, or the hours, or the kind of care that you want to provide, and the time that you want to put into it.
Is the training path any different for hip preservation surgeon, or is it the same for orthopedics generally?
So you would first do orthopedic surgery residency, which allows you to kind of see all the different specialties, and then from there you would further specialize within hip preservation. And there's different ways to go about that, whether it's pediatrics, whether it's adult reconstruction, or whether it's sports medicine. And so there are different ways to kind of get to the hip preservation specialty.
Is there anything you would change about your journey if you could?
Not that I can think of, just that I gotta say I'm still on the journey, and I love every minute of it, and not at all.
And lastly, if there was one thing that you would want hip surgery patients to know, what would it be?
Wow, that's a great question, and it's hard to answer, but I think understanding, and a lot of the things that I see and treat, sometimes understanding that whether it be hip disease or other things, I know you're interested in hip dysplasia, and we're psyched for hip dysplasia, but that it really is somewhat like hip disease, and whether it's a surgery or a physical therapy or anything, it doesn't cure it, unfortunately. And so this is why my heart is so invested in these patients, because it is a very difficult disease. And so even a PAO doesn't necessarily cure it. And so understanding these patients from the beginning to the end and everything in between is what I really enjoy. And so I think for the number one thing would be to understand that hip dysplasia is somewhat like hip disease, and it's sometimes chronic, and there's no necessary cure for it, although the treatments that we give can help, but still some patients have some discomfort and issues that they battle through for a long time.
Okay, thank you, Dr. Wells, for joining us today and for taking some time and answering all of our questions. We really appreciate it. Everybody, have a great day, and thank you, Dr. Wells, again.
That was great. Thank you for the opportunity.